Hi, you guys. Welcome back to UWorld's Next Gen NCLEX review session. We're so excited to have you guys here today. This is going to be our inaugural kickoff of dosage calculations. So thanks for joining. We have 5 questions we're going to go through. Just a little quick shout out to our friends on TikTok. Make sure you guys share this live session. The more the merrier. We'll have this on demand on Facebook and YouTube afterwards. But I think without further ado, we'll kind of just jump into this. So we're going to walk through 5 questions today. We are doing weight-based calculations. So we'll kind of talk through this, and the approach we're going to take to these questions is going to be dimensional analysis. So I have a question kind of set up for us. We're going to use our fancy pen. We're going to write on the screen. I'll let you guys have a little bit of time to kind of get your calculations together. But if you have a pen, pencil, pen, paper, however you want to do it, follow along with us. And again, you can always watch these on demand on Facebook and YouTube and practice the questions again on your own. So, all right, well, welcome everyone. We'll go ahead and jump in. Again, my name is Jackie, a nurse here at UWorld, and we're glad you're here. All right. Okay, so I'm going to read the question, and I'll give you guys, I'll kind of, I think what we'll do, I'm going to read the question. I'm going to get us set up with our equations and kind of walk through it, especially for this first one. And then you guys use that chat. We have our content experts on there. They're monitoring everybody. We'll let you guys answer, and then I'll take some time and go through kind of the final steps of all of this. But we'll work through this together. It's going to be fun. We're glad you're here. So, all right, question 1. I'm going to go ahead and read it, and we'll get going. Okay, so the clinic nurse is caring for an 11-year-old client who is prescribed once weekly triamcinolone injections. How many milliliters per dose should the nurse administer? Record your answer using 2 decimal places. So one thing to note, whenever you see these questions, maybe on the NCLEX, you're going to have some exhibits, but for our purposes of how we're working through this today, I'm going to give you all of the information you would see in exhibits like right in front of you, so we have it to work through these. But do know you'll see another sentence that'll say, click the exhibit for more information, and you'll see maybe like an image of a medication label, some weight, the prescription itself, so you'll have all of this, but you'll click through it in different ways, but it'll all, essentially it's the same kind of information. So okay, so we are going to go ahead and start working through this. So again, we're going to be using dimensional analysis, and really what happens with dimensional analysis is we're going to take what we've been given as a prescription, how that medication is prepared, so how it's available, and we're going to do some math to kind of make all of the units work together to what we really need to give to the client. So I'm going to get us all set up, and we'll kind of go through it that way, and we're going to take the same approach as we go through all of these, so you'll see this over and over again, so hopefully it'll help stick. So what we're going to do is we're going to kind of make like an original equation to help us follow along. So we are going to say what is prescribed times what is available is going to equal what is required. Okay, so knowing that, let's look at what we have here. So we have a prescription, so that's going to correlate to what's prescribed. We have the availability of the medication, so that's going to correlate to our available. And then we also have what is required, and that is in the question itself. So we are looking for milliliters per dose. So knowing that, I'm going to kind of set us up with what we've been given. So our prescription is kind of like written in ink. We can't change this, and we can't change what's required, but what we can change is everything in the middle. So we're going to kind of walk through it that way. Okay, so I'm just going to start with units. So what's been prescribed is micrograms per kilogram per dose. What is required is milliliters per dose. And what is available is milligrams per milliliter. But what we want to do, so this is a fraction. We can swap a fraction and it can still remain the same. So we can see here, what is available to us, we have milliliters on the bottom. But what we need is milliliters on the top. So you can see that over here on our required area. So what we're going to do is we're going to take what's available and we're going to flop the order of the dosage. So we're going to say milliliters over milligrams. Okay, so now we know we are working with, we're trying to get to milliliters per dose. What we're starting with are micrograms per kilogram per dose. So we can see we have dose on the bottom, great news. We have milliliters on the top, great news, but we have some work to do in between. So the first thing you're gonna wanna do is incorporate weight into these equations. So we see here kilograms, but our client is weighed in pounds. So we're going to start with conversion of weight. So we know that kilograms and pounds can speak to each other. So we're going to have kilograms here over pounds, and then we are given pounds, so we're going to put pounds up here. And this is going to be like our weight input into the equation. And this is all going to cancel out and be super nice and neat and get us to where we need to go. Okay. So the other thing we have is micrograms and milligrams. So we need to have a conversion in there so that we can cancel all of those out, because milligrams and micrograms are not at like our end goal here. Okay, so we are going to say micrograms has a conversion factor for milligrams. Okay, so now looking at this, let's go through and we're gonna do our nice, exciting, fun cleanup and make sure that what we have left in our equation is gonna be what we're looking for our required answer. Okay, so we have kilograms. So this is a weight-based calculation. We have crossed out kilograms, we have crossed out pounds. Let's see, we have micrograms. We have micrograms, micrograms, milligrams, milligrams, and look how nice and neat this is. We have dose and milliliters, which is going to correlate with what we're looking for in our answer. So let's take this and we're going to add our numbers in. Okay, so our prescription says we have 200 micrograms per kilogram per dose. We know 1 kilogram equals 2.2 pounds, and our client weighs 90 pounds. Okay, we also know that there's 1,000 micrograms in 1 milligram, and our medication is available in 10 milligrams per 1 milliliter. Okay, so knowing that, that's going to get us our answer in milliliters per dose. Okay, so now we have all of our numbers in. What you're going to want to do when you do this math is you're going to want to go all the way across the top and then all the way across the bottom. So you're not going to want to stop. Like, don't hit equals until you get to the very, very end. Okay, so I'm going to pull up my calculator. And we are going to just start going. Well, first, you know what I think is going to be helpful? Let's cross out our units again so it looks nice and neat, and we know that what we have remaining is what we're looking for. Okay, so our weight has been accounted for, kilograms, kilograms. Our pounds have been accounted for, pounds, pounds. Our micrograms have been converted into milligrams, and our milligrams cancel. So again, what we're left with is dose and milliliters. So let's do our math. So follow along as we go here, but what we're going to do is say, and I'm just using my phone here, that's what you're seeing. Okay, so just follow along if you have your calculator. We're going to say 200 times 90, which is our weight, times well, actually, you don't need to hit times again because those are all ones. So you're going to do 200 times 90. Then we're going to move to the bottom. We're going to say divide 2.2, divide 1,000, divide 10. And your answer, you're going to see, is 0.8181 that repeats. Okay. So that's where we're at. We're getting closer. Okay, but let's look back at our question. So our question says record your answer using 2 decimal places. So our final answer, seeing how we have that repeating decimal, is going to be 0.82 milliliters per dose. Okay, one thing you always want to have is that leading zero. The reason for it's going to elude the reader that there's a decimal point. So there's no way you can get confused that this is 82 milliliters per dose. That would be a gigantic medication error. So our correct answer is going to be 0.82 milliliters per dose. Let's see how you guys did. Good work. And okay, as I typically do, got excited and gave you the answer. Maybe a little bit too fast, but I will fix that on the second one. Okay, so we're gonna move on to our next question. All right. And question, oh, and then I gotta erase this here. Oh, no, okay, hold on a second. Let me hit the eraser. And there's gonna be a quicker way I can do this. Sorry guys, hold please. New technology. Which one is it? That one. Okay, got it. Moving forward, I will erase quicker. Okay, all right, we're back. Okay, so I will read this question. We'll kind of go about it the same way. I'll get it all set up, and then we'll go from there. Okay, so this is question 2 of 5 here on weight-based dosage calculations, if we have anybody new joining us. Okay, so I'll read this. The nurse is caring for a 4-year-old client who is prescribed carbamazepine for seizure disorder. How many milliliters per dose of carbamazepine should the nurse administer? Record your answer using 1 decimal place. Okay. So kind of starting how we did before, we're going to take the same approach. What we need to do is take our prescription times our available is going to equal our required, and we're going to do dimensional analysis again. Okay, so let's start. So I'm going to write down this. So we have our prescription times available is going to equal our required. Okay, so knowing that, let's go ahead and start plugging in our units for this. So we know our prescription is here. We have these units, milligrams per kilograms per day. So that day is different than what we saw last time, which was dose. So let's kind of see how this might work for us. Okay, and so we'll start with that. So that is one of those written in pen. We can't really do a whole lot with it. We need to, it's again, what's in the middle that we can change. So we're going to start with milligrams per kilograms per day. And then what is required is going to be up here, our milliliters per dose. And then what is available is, again, right here, and this is our milligrams. We have milligrams over milliliters, but same as we did before. We can swap that like fraction, and it's going to be the same thing. We can have that flexibility with that. We're not changing the numbers for it. So with that, we're going to put our milliliters up here and our milligrams. Okay, so we can see here, like we're looking good on the top. We have a milliliter available for us on the top. We have dose on the bottom for what we're required, but we have day on the bottom for what we've been prescribed. So we know we're going to have to do some finagling there. And then for our prescription, we have milligrams on the top and milligrams on the bottom. So we know that's good. We don't have to change like our proportion. Okay, so let's put in some of our other units here. So again, this is a weight-based medication. We know that because the prescription says kilograms per day. So let's go ahead and put this in. So we know that our patient is dosed in pounds, or they're dosed in kilograms, but we've been given pounds, so we're going to make a conversion to pounds. So we're going to say 1 kilogram over pounds, and then our client has a weight in pounds. Okay, but the thing here, so again, we're trying to get to dose, but we've been given day. So we know here that our prescription is in day, but it needs to be divided into 4 doses. So we can say that convert our day to doses, and we'll add that number in. Okay, so looking at this, let's go through and do our exciting cross out, which makes it all nice and neat and clean. Okay, So again, this is weight-based medications. We're going to cross out our kilograms. We're going to cross out our pounds. We're going to cross out our milligrams. So, and then cross out our days. So now we have nice and neat milliliters on the top, doses on the bottom, and that's going to be what we're looking for our required calculation. Okay, so let's add in the numbers, and then I am going to give you guys a chance to do the calculation yourself. Okay, so our prescription says 20 milligrams per kilogram per day. Our client is in pounds, but this is weight-based, so we need to convert pounds to kilograms. So we know 1 kilogram equals 2.2 pounds, and our client weighs 38 pounds. Okay, then we also know, now adding in our numbers, that 1 day is 4 doses. And our medication is available in 5 milliliters per 100 milligrams. So I will let you guys do that math and see what you get, and we'll go from there. Okay. All right, let's see. How's everyone doing? I know this is tricky, but you guys are doing really good. Awesome. Okay, I'm seeing a lot of right answers, so good job, you guys. And again, this will be available on demand, so if you want to go back through and practice these, you totally can. And then also, we have a lot of great resources available on nursing.uworld.com, and especially we have a dedicated med math product that you guys can do tons and tons and tons of practice, and that's really the best way to go about all of this, is just practice these questions over and over and over again, setting them up, making sure your units match, knowing how to kind of cross everything out. So don't be discouraged, don't get frustrated, you'll definitely get this. So, okay. All right, so knowing this, let's see how everybody did. Okay, so we'll go through and start kind of crossing out our units. So kilograms, kilograms, pounds, pounds, day. We're left with doses down here, milligrams cross out, and then we're left with milliliters. So when we do our calculation, okay, we're going to start with at the top. So we're going to multiply the numbers on the top, and then we're going to divide the numbers on the bottom. So you'll key it into your calculator as 20 times 38 times 5 divided by 2.2 divided by 4 divided by 100. And you will get 4.318, and that 18 repeats. But again, we're looking for 1 decimal place. So our answer is going to be 4.3 milliliters per dose. You guys did good. I see a lot of right answers on here, so well done. This is tricky. Okay, you did great. All right, so we'll go ahead then and move on to our next question. Okay, so let me make sure I'm doing this, and then I do this, and then I hit this one. Do I push it and then hit it? No? Sorry, guys. This part I didn't practice. Oh, I did it. Okay. Woohoo. Okay. Okay, we're back. Clear screen, 1 random dot, but we're not going to worry about that. It's just going to get incorporated into our our next math here. Okay, so we are moved on to question number 3. We're doing okay on time. We have 5 questions, and they get a little bit faster as we go. So I will read it. We'll get it set up. I'll let you guys do your calculations and your math, and we'll see how we do. Okay, and this is going to be kind of a 2-part question, but it's going to be set up largely the same as what we've been doing. Okay, so I'll read the question. The nurse is caring for a 14-year-old client who is prescribed IV push nalbuphine for pain management. How many milliliters per dose of nalbuphine should the nurse administer? Record your answer using 2 decimal places. Okay, So we have dosing weight 114 pounds. We've got our prescription, everything. So again, same idea as what we've been doing. We're going to set this up using dimensional analysis. We're going to take the approach of our prescription times what's available is going to equal what's required. So ready? Oh boy. Okay, I hit something. I'm good, right? Okay. I don't know what happened. Okay, so we have our prescription times available is going to equal required. There's a little bit of extra confetti on the screen, but that's okay. Okay, so knowing that, let's kind of look through and see. So again, what we input for our prescription, that's from the physician. It's written in stone. We can't really do a lot of manipulation with it. What's required is what the question is asking us. So again, that's like our PIN. It's what's in between what we kind of input into the dimensional analysis is what we have the ability to kind of manipulate. Okay, so our prescription comes to us in milligrams per kilograms per dose. What is required, and we have that from here, milligrams per kilograms per dose. What is required is up here, which is milliliters per dose. Okay, and then what is available is right here, which is milligrams per milliliter. But again, seeing this, we need milliliters on the top. It's a fraction. We can just flip it. So we're going to say we're going to have milliliters up here and milligrams on the bottom from what our available is. Okay, so again, this is a weight-based dosage calculation. So it's asking us, we need to input our weight, but our weight has been given to us in pounds, so we need to convert that into kilograms. So we know that kilograms and pounds communicate very nicely to each other. So we're going to convert our weight into pounds. And let's see how we're doing. That's really all we need to do for this one. So when we look through how these all kind of communicate to each other, we're going to be able to cross out our units for kilograms. We're going to cross out our units for pounds. We're going to cross out our units for milligrams, and what we're left with is milliliters and dose, which is exactly what we need. So I'm going to give you guys a chance to put the numbers in and do the calculation, and then we'll go from there. Or I can, if you guys want me to put the numbers in, maybe that's easier, then you can do it. You don't have to keep it all straight. But I'll let you guys kind of take some time and answer, and then we'll go from there. Okay, so again, this has been given to us in 0.15 milligrams per kilogram per dose. We know that 1 kilogram equals 2.2 pounds, and our client weighs 114 pounds. What is available to us is we have 1 milliliter, 10 milligrams in 1 milliliter. So this is like how the medication is packaged, if it's in like a vial or a suspension, anything like that. And again, this is going to yield our answer in milliliters per dose. So when we go through and we, cancel out our units for weight, we cancel out our milligrams. Again, we're left, that kind of looks silly. Looks like, I think I hit a button. There we go. Dose, milliliters on top and dose on the bottom. So I will let you guys go through and do that math, and then I will put the answer down. See how you guys did. And again, we're looking for 2 decimal places. 2 decimal places. Let's see. I'm seeing some good answers on here. Okay, so we have, I'll go through, start putting our numbers in. So I'm seeing good job on Instagram and TikTok. I'm seeing some good answers coming through. Good work, you guys. Okay, so we're going to say 0.15 times 114 times, I'm sorry, not times. You can say times 1 if you're clicking in as I'm saying it. Divided by 2.2 divided by 10 is going to equal 0.6 0.7772. Okay, but again, we're looking for 2 decimal places. That's what it's asking us. So our answer for this is going to be 0.78 milliliters per dose. How'd you guys do? Yes, good work. YouTube, Facebook, good job, you guys. And again, we have to have that 0. We want that leading 0, so there's no error that this is going to be like 78 milliliters per dose. So we always want to include that 0. All right, so that's our answer. Okay, so we're going to go on to the next question, and this one is a little bit different. It's going to include the same stem for this, but it's also going to include, it's going to ask us if the total amount that we're giving is safe, because we see in here, it says do not exceed 160 milligrams in 24 hours. Okay, so watch me do this. Guys, I'm going to get this on the first try. Okay, we're going to go to our next question, and then we're going to, I did it, yay. Okay, then I got to make my pencil come back. Okay, wins for the day. Okay, so this next part, so part 2 of this question is saying, if the client requires nalbuphine every 3 hours in a 24-hour period, is the prescribed dosage safe? Okay, so this is going to be set up a little bit different. We're not going to do prescription times available equals required. We're going to do prescription times frequency equals required. So stick with me on this. Okay, so again, we have our prescription here. So it says, same as we would set this up before. So we're going to say prescription times frequency equals required. Okay, so we know then when we put in these units, so again, it's asking in this 24-hour period, is that safe? So 24 hours, think a day, let's kind of see what we're working with here. So our prescription, again, can't change that. It's given to us written in pen. We're going to say our units, as we've been setting these up, milligrams per kilograms per dose. So that's what it's given to us, is in a milligrams per kilograms per dose. Okay, and what is required is going to be how many milligrams we can have in a day, because we're trying to see in a 24-hour period if how much this is dosed, if we give this as it's being prescribed every 3 hours, if that's a safe amount. So that's going to be milligrams per day. Okay. So looking at this kind of from here, we have milligrams on top, which is great. We have dose on bottom, but we have day on bottom on the other side. So we have some work to do. And then we know that the frequency of what this is being given is in an hours. So we have hours, and then in a 24-hour period or a day, which is what we're trying to say. So we're going to say our ultimate goal for frequency is going to be hours per day. Okay, so again, same idea we've been doing this whole time. We're using dimensional analysis. This is a weight-based medication, so we have to incorporate weight into the dosing. So we know our client is weighed in pounds. We need to convert them to kilograms. We know kilograms and pounds communicate very nicely, so we're going to make that change. So we've got all of that in. We know that currently the frequency this medication is being given is in hours. So for every dose, it's being given in 3 hours. And then we know that what we're looking for is hours, is a culmination of what's given in a day. So we're going to convert hours and days. Okay, so knowing that, let's put our numbers in. I'll let you guys answer, and then we'll see if this medication is safe or not. Okay, so again, oh no, the news keeps popping up. I'm so sorry, I don't know what I'm hitting. Okay, so we have 0.15 milligrams per kilogram per dose. We know that 1 kilogram is 2.2 pounds, and our client weighs 114 pounds. Okay, we know that there are, in one dose, we know one dose can be given every 3 hours, and that one day has a max of 24 hours. So we know this is going to give us what we're looking for milligrams per day. Okay, so let's make sure we cancel out all nice and match up. So kilograms, kilograms, pounds, pounds. We have dose, dose, hour, hour. So what we're left with is milligrams on the top and day on the bottom, which is what we're looking for over here. Okay, so I'll let you guys do that math and we'll see where we come, what number we come to. Okay, let's see, how are you guys doing with this one? This one's a little bit tricky, but it's a yes or no answer, so kind of have a 50-50 shot. Let's see what you guys think. Okay. All right, so I'm going to go ahead. I'm seeing a lot of good answers come in. You guys are doing great. All right. Okay. So, and again, this one is asking about, is it safe to give in a 24-hour period? So we're not worried so much about the preparation of it. It's more so the dosing per weight that we're worried about. So that's why this like medication availability, it's not incorporated into the equation. Okay, so let's do our numbers. We're going to do 0.15 times 114. So here, times 24, times, oops, I hit 27. 0.15 times 114 times 24, divide by 2.2, divide by 3, and that is going to give us 62.1818. But again, we'll round this. It's not asking us for anything specific, but we're going to say 62.2 milligrams per day. And right here it says do not exceed 160 milligrams in 24 hours. So we know 62.2 is less than 160 milligrams per day. So this is safe. Yes, safe. I hope you guys got that. Good work. Awesome. I'm seeing a lot of good answers come in. You guys definitely got this. So good job. Okay, we have one more question and then we'll be done. You guys did awesome. Okay, check me out. Gonna do this and this, then I do this, and then, yes. Okay, this one's a little bit easier. This one is about tablets, and it'll be a good one to end on. So I'm gonna really let you guys kind of take the lead on this one, see how your answer comes out. And but again, I'll walk through it. I'll get it all set up for you and see what your answer is gonna be. So good work, everyone. You're doing a really good job. Okay. All right, so the nurse is caring for a 9-year-old client with recurrent ventricular tachycardia who is prescribed amiodarone. How many tablets per dose should the nurse administer? Record your answer using 1 decimal place. Okay, so we have our weight, our prescription, how the medication is prepared. Okay, so starting as we have previously with all of this, we're going to set this up as our like little equation, and we're going to use dimensional analysis. Okay, so we have, I'm trying to not turn the news on again. Okay, prescription times available equals required. Okay, so what we have is our prescription here. So, and then what we have available, like how the medication is prepared, so like how we can access it is here. And then what's required is up here. We're looking for tablets per dose. Okay, so we know our prescription is available in milligrams per kilograms per dose. What we are looking for is tablets per dose. And how it's available is milligrams per tablet. So again, we have dose matching up, but we don't have tablet yet. So we want to make sure that when we put in this available, we flip that preparation. So we're going to say tablets here for what's available over milligrams. Okay, so then we need to incorporate in our weight. So again, we're trying to incorporate the weight so it cancels out and it's part of the equation. So we know that our client is in pounds, but we need to convert them to kilograms. So again, simple conversions, we know 1 kilogram equals 2.2 pounds, and we have our client's weight in pounds. So we're gonna go through, cross these out, make sure everything is communicating nicely. So on the top we're going to have tab, which is great, and on the bottom we have dose, which is what we're looking for. Okay, so I'm going to let you guys kind of take it from here, put those numbers in as I'm writing this through and do your calculation, and then I'm going, oh, you guys, I just looked at the chat. There's a ton of right answers. I'm so proud. This is not easy at all, but you guys are doing so good. So well done. I'm going to go ahead and put the numbers in then. So again, our prescription, oh no, okay, is available in 10 milligrams per kilogram per dose. We know that we need to convert our weight, so 1 kilogram is 2.2 pounds. Our client weighs 66 pounds. Then our medication is available in 200 milligrams in 1 tablet. And this is going to equal our tablets per dose. Okay, so again, kilograms, pounds, weight is accounted for. Milligrams, dosing is accounted for. So we can get the end result of what the client is consuming as tabs per dose. So let's do our math. So across the top, we're going to do 10 times 66 divided by 2.2 divided by 200. 1.5, which so many of you guys got. I'm so impressed. Well done. We did it. Yay! Good. Oh, and I guess this is saying also 1 decimal place. So, but there was only one option for a decimal on that one. And we wouldn't want to give anyone like 1/3 of a tablet anyways. So, okay, you guys did great. I hope this was fun. It was helpful. We're going to try these again next week, and we'll incorporate this into kind of our Wednesday live schedule. But we appreciate you all being here. As always, come check us out on nursing.uworld.com. We have amazing resources. We have a full bank of questions with for med math for these dosage calculations. It's going to walk through the approach we did today, which is dimensional analysis, but there's alternate methods, and we walk through those too. Dimensional analysis is typically one that's kind of incorporated into a lot of nursing schools, and really one that kind of allows you to be pretty foolproof. Like you can see, as we walk through these, you can see how units crossed out and how you can kind of work with the numbers and manipulate what's inside of those pinned data points to get what you're looking for. But we hope this again was helpful. As always, check out our free 7-day trial by going to nursing.uworld.com. You'll see all sorts of great questions and resources on there. Make sure you subscribe and follow us on your favorite social media channel so you can get our schedule of upcoming live sessions. And we hope to see you tomorrow. We're going to be doing a drill of multiple questions focused on pediatrics, kind of relating back to what we talked about on Tuesday. So we hope you'll come join us, and hope you guys have a great day, and we'll see you tomorrow. Bye.